thank you, everybody, for first for coming back to Columbia today for our full meeting of AccelerateSC. I will tell you the work that each of the component groups did last week was productive. It was you talked about issues that were important and solutions to issues, and that's exactly why we have this group in place. So I appreciate your commitment to being here, to participating in a very meaningful way, and to, as you come in the door, that this isn't just about your individual organization or an entity you support, but it's about the state of South Carolina. And so thank you for everybody being committed to that proposition. I'm going to ask Dr. Hamlet to pray real quick before the governor gives his comments. Dr. Hamlet.
Let's pray together. Father, as we come before you today, we continue to seek to join together to face this crisis that we're in the midst of as a state. Lord, thank you for those that are gathered here today. Each of us are impacted by it, and I pray today for each of these who are facing their own way, their own families, the challenges that we have. And we pray that this will be a productive time. We thank you for our governor, for our leadership, and we pray that you would guide us as we seek to continue to move forward. We pray in Christ's name, amen.
The governor's going to give us some comments, and then we'll hear from the lieutenant governor after that.
Thank you very much. I'll be very brief. I want to thank everybody for the hard work and thinking that we've done between the last assembled meeting and this one. And I suppose we'll have another assembled meeting at a later date as we continue to work to find solutions and the way forward. Just a few things to keep in mind for perspective as we meet here. Right now we've got about, the latest number is somewhere over 400,000 people unemployed, recently unemployed. Before this coronavirus got here, we had about 2.3% unemployment in the state. I don't know what the percentage is now, but it's a lot more than that now because of this virus. Unemployment claims at Department of Employment and Workforce as of Sunday were 222,000, unemployment money paid on the claims, $222,205,337. That's out of our trust fund, which was above $1.1 billion and now is 900 and something million. 222,205,337. The federal money that's paid out, that's the $600. It piggybacks on the unemployment that goes out with South Carolina unemployment. 508,530,966. Again, 508,530,966. And the federal self-employment unemployment, which is a new thing that we don't have here, but we do with the CARES Act, so far is 15,548,125. Again, 15,548,125. The total amount paid through the SBA Paycheck Protection Program, the first and the second issuance, and we're still working on the second issuance, and the South Carolina Economic Injury Disaster Loans, and the South Carolina Economic Injury Disaster Loans, the advanced program, is a total of $5,764,691,776. I say again, $5 billion, this is in South Carolina, $5,764,690, this is a big number, $5,764,691,776. And keep in mind that usually the state part of our annual budget a few years ago was $8 billion, now it's around $9 billion, and that just gives you an idea of the kind of numbers and the kind of unemployment and the kind of consequences we're dealing with. So our job here is to be sure that we get out of these numbers and we get back to work, but we keep our people safe and healthy. So we got to be real smart in doing this. But we got a lot of folks that are unemployed, that don't want to be, that are anxious to go back to work. We have people, particularly those in nursing homes and elderly people and people that have some underlying conditions that are fearful of getting back out. We got to do a lot of balancing and a lot of thinking and a lot of innovating in order to get South Carolina back on top, which is where we were economically in our quest for prosperity before all this happened. And those of us in this room are going to be very important and influential in getting that done. We got people that want the haircut. I get letters from ladies that are dying to go to the beauty parlor. Of course, we don't want them to die when they go to the beauty parlor. That's the thing. But the barbers, the hairdressers, the stylists, the restaurants that are ready to open back up, they are all on our minds, as we all here know the harm that is being caused to the business, and the smaller the businesses, the more harm is being caused by this virus. And many of the lack of a market and things that are beyond our control, that have nothing to do with the orders and decisions that we've made, but are just a part of this landscape out there. You have the auto industry in Detroit who wants to open up, but they can't get their parts from Mexico. We have a lot of our industries that close some of their lines or closed down, not because of the virus, but because of the supply chain. So we're in a mighty big worldwide pond where things that happen elsewhere in the country and in the world affect us right here in South Carolina. But our job is, a lot of those things we can't change, but we can chart a course for our people and our businesses and our industries across the board that is smart. I think we've done that so far. We're doing a lot better than most states, is because we've been deliberate and careful and targeted in what we've done, and we need to do that, but we need to move as quickly as we can and as safely as we can. So again, I thank you on behalf of the over 5 million South Carolinians that are looking for us to make good decisions and offer good guidance and get us back to prosperity. I thank you for all of them for the work that you're doing.
Thank you, Governor. Lieutenant Governor Abbott.
Yes, I just would like to take a minute and thank everybody. It's great to see everybody again. I hope you all watched as the other committees met last week, and it was very informative, and I hope you're getting the feedback that I'm getting from businesses and just South Carolinians across the state, and how thankful they are that we are taking this deliberate approach to getting our state re-energized safely. So thank you for all you're doing. I look very forward to hearing everybody's recommendations today.
I should have pointed out earlier, Governor, Lieutenant Governor, I want to thank Superintendent Spearman and Commissioner Weathers, who have both been committed to this process and working with us, and also thank our the members of the General Assembly who have been working with us in an advisory capacity. I would also note that for everybody who may have not seen this on the AccelerateSC committee, that the President of the Senate and the Speaker of the House both appointed working groups as they come back into session next week and they get back to Columbia to address issues, legislative issues that may come up as a result of the work we're doing here. So obviously we appreciate the commitment of the President of the Senate and the Speaker. Just a couple of things for everybody, and I should have mentioned it before. We are all, again, socially distanced, and there were masks available at the front of the door. If you weren't able to get one and you would like one, you can just raise your hand and we'll make sure we get you one so that you have that, and there's hand sanitizer at your tables. I want to thank, real quick, Kevin Grind's staff and his staff from the Pestes Alumni Center, who have been exceptional in helping us, and a lot of their work probably isn't recognized. It happens when they're cleaning late at night, so and getting this room ready. With respect to kind of the component meetings this week, what I've done is I've reached out to the four chairs of the four components, as well as the coordinating state agencies, so that they could work together to come up with the next time that they would like to meet. I understand from everybody that, hey, we've got more work to do, and that's the kind of thing I like to hear, that we want to meet again. We understand that it may be difficult for everybody to make it to Columbia, so we make everything compatible to use WebEx so that you can participate remotely if that's what you need to do. I see that Dr. Pastides is on and Secretary Hitt are both on. Again, we'll get the details about those specific meetings out to you as I get them later today from our subcommittee chairs. With that, the way we're going to work today is we're going to start with Helen Hill, and as Helen's making her way up here, I've also asked Jennifer Noel to just be standing by on the other side of the podium, or Jennifer Fletcher, excuse me, sorry, Jennifer. And Secretary Hitt, of course, is online, so that if there are any questions that come up as they make their presentation, you can ask them. As I put in my email, and I'd like to just, so everybody knows, I want to take this opportunity as we hear the recommendations. If you've got questions about them, ask questions. I would ask that we not lobby for a specific thing that maybe just impacts you. We're looking at how we can collectively take some steps for the entire state. So that would be my one charge, I guess, to you for today is please ask questions. And so with that, I'll turn it over to my good friend Helen Hill.
Thank you, Mr. Chairman. And first, I'd like to say what a great job you're doing. Thank you. The governor picked the right guy for this hard job. But ladies and gentlemen, we are right now seeing the benefit of the common sense approach that we've taken managing this horrendous virus. Keeping as many businesses open as possible safely has been invaluable to us getting back to business soon. I'll tell you that everybody's been working hard. Dwayne Parrish opened his parks, and I had a good conversation with Secretary Hitt. He's even chasing some projects right now. So that is really, really good news. Last week, our response team really worked on how to safely open those close contact businesses like restaurants. We really wanted to focus on keeping the employees safe as well as the customers. Special thanks to John Durst and the South Carolina Restaurant and Lodging Association, Dwayne at PRT, Bobby Williams, thank you, and John Durst, thank y'all for the great work that you did at coming up with that amazing training, not only for the staff, but helping our visitors in restaurants know how to behave correctly. This past Friday, Governor McMaster issued that executive order that allowed restaurants to open for outdoor seating. And Governor, you made some really happy people to be able to sit and enjoy a meal outside. Our same group has recommended that perhaps we could return to inside dining the week of May 11th. Using this model, more guidelines are forthcoming with those best practices. The Commerce team, along with DHEC and OSHA, have created a framework for collaboration for these best practices. We're going to have a great template for everyone to use. Close guidance is coming right up, Governor, for those businesses like cosmetology and barbershop, because your subcommittee chairman would like to be re-redded, like you would like to have a new haircut. So those are forthcoming very quickly. We're also working on some overall recommendations for our attractions to get back to work with PRT. We have 5 attractions currently working on this. We also have a plan in place to promote getting those pools open, those fitness centers, and what we're going to do with our meeting space. We also want to talk more about the central location that we're going to have those guidelines compiled, and I don't want to steal anybody's thunder, so we'll let that come a little bit later. Now, when it comes to the personal protective equipment, you've heard from Secretary Hitt that there has been some challenges in our state, especially for small businesses. So we're running down 2 paths. We're looking at 2 options. One, perhaps a state-sponsored repository of that, and we're looking at the emergency supply chain collaborative to see if we can get those in the hands of our small business. So we'll continue to explore both of those options. I'm now going to let Jennifer talk to you a little bit about workforce and what's happening with small business.
Good afternoon. Another thing that our committee discussed is workforce, because clearly workforce is the backbone of all of our businesses in this state. And there are some real issues facing those employees as they consider coming back to work, for those who have not been at work or those who have been working. The first and the largest issue I think that we discussed was child care. In our meeting, the governor mentioned that 1,255 child care centers are currently closed, which represents over half of the child care facilities. And so we really need to figure out how to get more of those open over the next few weeks. So we're going to have to do a couple of things there, and our committee is going to have to continue to work on this. The first would be to get guidance out to them so that they can feel comfortable that they've got a playbook to open with. The other thing is trying to determine why they're not opening and see what sorts of actions that we could possibly take as a committee and a state to encourage more of them to open. Another thing we discussed was recall resistance, which is the result of additional unemployment compensation from the federal government, an additional $600 on top of the unemployment insurance from the state. So clearly there are some motivations for employees to come back, such as maintaining a position and or medical insurance from their jobs. But really what we want to encourage businesses to do if they encounter recall resistance is that they can file a claim with DEW and then take it from there, and those benefits will be rescinded so that we can encourage more folks to come back. The money does run out on July 30th, and we did have two visitors with us during our meeting, Senators Scott and Graham, and both of them have let us know that they do not expect additional compensation to be part of any new package that might come out in the future. The other thing that I wanted to update this group on, although our committee didn't touch on it too much at our previous meeting, it'll definitely be something we talk about in the future, and the governor mentioned it in his opening remarks, and that is small business and really trying to understand the impact that this has had on small business. And so the governor mentioned that between the Payroll Protection Program 1 and 2 and the Small Business Administration's economic injury disaster loans, that over $5.7 billion has been put back into these small businesses in South Carolina, which represents 56,000 transactions, loans or grants. So probably not that many companies, but close to that have received aid. And this is something that we are going to continue to monitor. The second round of payroll protection program does still have funding in it, and so companies are still encouraged to work with their lenders to apply for those funds. We're also looking at what are local communities doing. There are a number of local communities who are looking at various programs. So this is going to be something that we really need to continue to monitor. Since we are going to not have to worry about germs or cleaning the podium again, I'm going to give Helen's closing. So wanted to provide a brief update also. Secretary Hitt, when he opened at this first meeting of this large group, he talked about that some of the manufacturers had temporarily shut down, and the governor also mentioned this in his opening remarks. And I think one of the really good news and signs of light is that the Secretary keeps up with some of our larger manufacturers, and they are all indicating that they are reopening this month, most of them in the middle of the month. Still working on some supply chain issues, and we will continue to apprise the governor of those and see how we can help our companies through those. But that is all good news that those are opening. And so now what we're going to do, we're going to turn this over to Ted Pitts. We created a business survey to try to get an understanding of what some of our companies were dealing with so that our committee could take on some of those issues that came out of this survey. So we'll turn it over to Ted.
Yeah, thank you, Jennifer. Yeah, the governor's office reached out to us, and Commerce collaborated with us on developing a survey to get feedback from businesses. And one of the things Jennifer mentioned is the governor was specifically interested in small businesses, so we used our local chamber network from around the state as well as our statewide business industry associations like SCMA and others. So we used that to broadcast the survey, So you'll see we had approximately 4,500 responses. Of those responses, 68% of them were businesses with less than 24 employees, and the vast majority of them have been in business longer than 15 years. So all of you will be given the presentation, and you'll also be given the results of the survey that you can look through on your own. The two biggest issues that came up, first were lack of demand for the product or service. So as we've shut down or slowed down the economy and people stayed home, there's a lack of demand for products and services. And then the second thing that they raised as an issue was the ability to cover payroll or bills. So if you aren't selling things, you can't make payroll or bills. So those were the two biggest issues that came out of it. And then of the respondents, 37% had received some sort of federal assistance. So most of it's the PPP loans, some of it was the emergency assistance or the loans through the SBA. That 37% was very across when, at the end, we'll break down under 50 employees and 51 and up. You know, those numbers were very close. So the large employers, I think it was like 37%. The smaller employers, a little less than that. But about a third of them, both large and small, had received some sort of PPP assistance. And we know that that was available for companies with less than 500 employees. Next slide, Zach. All right, so if you talk about workforce, 40% of respondents have already laid off or furloughed employees. So the survey was open for a couple weeks. It closed Monday, yesterday. So 40% of the respondents had already implemented furloughs. The next bullet point, of those 40%, 43% said they don't expect they'll bring back all those employees within 3 months. So folks talk about coming out of this quickly. Folks that have already furloughed employees say that in the next 3 months, 43% of them said, I don't think I'm bringing everybody back on board at that time. And you touched on the additional unemployment assistance. That runs out at the end of July, so we have an issue there, obviously, that hopefully you've got employees begging to come back, but you got employers saying, I don't plan to bring everybody back. And then 40% of the respondents have either already implemented pay cuts across the board or with executives, or either in the process of planning to do that. So in addition to the furloughs, also companies have also implemented pay cuts or adjustments for employees. Next slide, Zach. Reopening and restarting. So 64% say they're worried about workplace safety liability. That's one of their top issues. 78% say they have a heightened focus around all those things that we talk about, hand washing, sanitizing services, what you do with employees that are sick. Do you now say, we're going to pay you to stay home, you don't have to use a sick day, you just stay home? How are we going to handle that sort of thing? So 78% have a very heightened focus about how they come back to work safely. 60% say the biggest challenge is retaining customers or demand. So they're worried about being able to have those folks buy their products or their services. And then 37, a little over a third, say we're looking for guidance. We want to reopen, but we need guidance to follow so we can do it in a safe fashion. And 40% say we're concerned about where and how do we get enough PPE to either have for our employees or our customers. So PPE that was touched on is important. And then 50% say that to start reopening, we need to lift orders. And you know, it's a generic question. I think what it means is it wants people to start moving around in normal activity, and they think lifting orders does that. Last slide. So we just broke down a lot of the data points were very similar between 50 employees and below and 51 and up, but these were some of the things that were different between those two data sets. So the first bullet point, first I'll show you that 50 and under was about 3,700 respondents, and then 51 and up was about 725 businesses that responded. When you look at concerned about meeting payroll or paying bills, 40% of the small employers says that's a huge issue to them. Only 20% of large employers say that's a huge issue to them. 40% of small employers are worried about paying bills, and then 15%. So the first was for making payroll, 40 and 20. And then if you look at paying bills, it even gets further spread. 40% are worried about paying bills that are small employers. 15% of the large employers are worried about paying bills. Under the current state of kind of a slowdown, 31% of the small employers say, I just can't operate. Either I'm a retail establishment and I can't sell my goods, or I'm a small operator. I just can't operate under the current environment. And then 12% of large employers said the same thing, so a pretty big spread there. When you look at work from home, a lot of the larger employers have been able to institute work from home. 33% of the large employers have some sort of work from home place in process or process in place, and only 20% of the smaller employers say we can even do that. And then when you look at workplace safety and the liability issues, 83% of large employers say that's a problem. 60 say that's not a problem, and I will tell you from talking with small employers, the reason it's lower than the large employers is they just haven't thought about it. They don't have an attorney on staff that's saying, hey, have you done these things? Are you concerned about these things? So when you look at that, that issue is something that needs to be addressed. And then when you look, we talked about the same number of large employers or percentage of large employers and small employers were approved for PPP. Well, when you look at who was denied or is still waiting, there's still 31% of our respondents said, I've applied, but I was either denied or I haven't been told if I've been approved or not. And there's only about 11% of the large employers that were still in limbo or waiting for those sort of results. So I would encourage you to look at the surveys that were provided to you. If you have any questions or if you want to pull any crosstabs, we can help you do that. We provided it to the consultant that's working with Commerce on looking at ways to restart South Carolina, and happy to answer any questions if there are any.
Ted, I have a question for you. I'm going to ask you this question, or I can ask it to Jennifer and Helen. On the issue of when you talk about liability reform, now Senator Graham mentioned to us that I think that they were looking at that being a centerpiece of this phase 4 that they're looking at in Congress. But, you know, subject to depending on what happens there, what do you see as the process here for something to take place?
Yes, I think it's going to require legislative action here on the state level. You know, we're working with Sarah and SCMA and Christian and the Hospital Association and the Retail Association and Rebecca and other associations. You know, there are some safe harbor provisions that need to be put into place for some period of time, a short period of time to cover this. So we're actually working together on presenting some things that can be done to help make employers feel like it's safe. If they're doing the right thing, we're not trying to protect bad actors, but if they're doing the right thing and using the knowledge and the information that's out there to keep people safe, that there is some understanding that there's a safe harbor to be able to open back up and safely do that.
Okay. That's very helpful. Thanks, Ted. And I have one question over for y'all.
Sure.
I know that y'all have been putting together, working with a number of groups on some guidelines, and I know that was something that we learned from the Chamber's survey that, hey, we want to follow the guidelines. I actually think it was Mr. Swink who mentioned during the meeting about, look, our businesses, they want to do the right thing. And so can you just talk briefly about that process and how that's working, just so we have that for the benefit of everybody?
Sure. What we have created is a 3-agency collaborative between Commerce, DHEC, and OSHA. And really, Commerce is there to be somewhat of a facilitator and run down information as it's needed to find these best practices, to work with trade groups to understand, you know, some of the challenges that might be present in their particular business sector. And then we've created a priority list based on the current businesses that are still not considered non-essential because they are the close contact businesses, and we are working through those with the organizations and of course also with our response committee to get any input. So there are several right now. There's probably close to 10 or 12 that are in the works that we expect a couple to be completed today or tomorrow, and then we will continue to work through those. So some of the ones I think that everyone's interested in are obviously the close contact, the salons, as Helen mentioned, fitness facilities, places of worship, pools, those sectors in hotels that are no longer open. And so that's how we're working through that, and working through that as expeditiously as possible. And all of the information will be available in one single place, which again will be discussed later this afternoon. And those will be posted as soon as they're approved.
Awesome, thank you. Does anybody else have any other questions? Senator Malloy.
I just want to respond once again. I think that there's a request for safe harbor provisions, and just want to make the committee and you aware that we've been called back into session on May 12th. Right now, my understanding, we only expect to be there maybe a day. The most important thing that we can do during that time is a continuing resolution to end up keeping South Carolina government open, and then maybe we'll have a sine die resolution that comes along with it. After that, we're subject to the call, if the sine die resolution is passed, for the Speaker and the President to end up bringing us back. We anticipate that our time to come back will be September 15 for 2 weeks. And so, having said that, it is very difficult, whether the desire is there or not, to end up having new legislation passed during that period of time. It's just a time issue. And so I think that if there is something that folks could agree upon by unanimous consent that we could end up doing in September, it would be. But my fear is that that's not going to be of help, and I want to say that as we go forward to before anything happens, so that we can make sure that we can measure expectations. I think one thing to do is to look on the calendar now to see if something is absolutely germane to the issue, and see if there's consensus amongst all of the groups to end up having to work on for the safe harbor provisions. So I would encourage the committee, if they're going to look for something that may be of help, to find something that could possibly be germane to an issue, to see that something that has already passed that would only require a small reading in the body, to see if there's a possibility of getting anything done.
Thank you very much. I think that is a very valid point, and our committee is actually working on potentially a meeting/call this week. So I think it's something that very timely advice, and we will absolutely take it under consideration.
Thanks. Senator Davis has a question.
Don't disagree with what my friend said, but what I would also say is a lot of the things that I've heard discussed in regard to the immediate legislative relief that's going to be a part of the recommendations being made, I consider to be fairly low-hanging fruit and not necessarily controversial or needing extensive committee debate. So I'm optimistic that there are some things. For instance, we've heard from the municipalities and the counties about wanting some flexibility in regard to the A-tax and the hospitality tax expenditures, some clarity in regard to virtual meetings, some flexibility in regard to budgeting, perhaps some acceleration of when they receive local government fund proceeds, maybe a suspension of payments on revolving fund loans. And I've got a list of other things as well concerning state agencies in terms of flexibility in regard to expenditures of money. I would still like to think that there is an opportunity for us to figure out, what those common sense, basic legislative actions would be. And my friend's right. All it takes is one senator among the 46 to object for it to then have to go through the committee process, which of course is going to be really pointless to us here because we need immediate action. But I would like to think that if we are realistic and modest enough in our approach, that there is going to be an opportunity when we go back in on May 12 to legislatively facilitate some of the things, some of the excellent things that are in these subgroup reports. And I just kind of paged through this, James, but I see that the governance section, anyway, the first one I went to, was very good at sort of breaking down, what the various recommendations are and then identifying what the legislative component to those recommendations are. And I would just say to members of the other groups as well, if there's something that you can send me that is specific in regard to legislative action, That's something that I could then discuss with Senator Malloy and Senator Turner and the other senators that have been appointed to this committee. And Senator Malloy is right. A lot of this, you know, if it's controversial at all, then all it takes is one senator. But I still am optimistic that we can find a common denominator on a lot of these things and maybe get it taken up by unanimous consent. Not best practices by any means, but maybe what the situation warrants.
Thank you. And again, I know that we're grateful to the President of the Senate and the Speaker for, of course, appointing y'all as advisory members of this group, and also for putting together a working group to consider some of the issues that come out of this, of AccelerateSC that require some legislative help. Dr. Ross?
Thank you, Mr. Chair. I really appreciate the guidance for child care. I was wondering, does that extend to the summer camps as they change different settings, some indoors, some outdoors?
Yes.
Okay.
So I think we conceptually are thinking of two different best practice guidance, but it might be one. We're just starting that one now.
We're working on it, because we know how much everybody needs it.
Yep.
All right, thank you all very much.
Thank you.
And as they are departing and we're sanitizing up here, I'll ask Christian Sora and Director Toomey to make their way up. Director Toomey, you get to stand on the other side of the podium and just be prepared for any incoming. And as they're coming up, one thing, I probably failed to mention this to folks, but I think it's happened at various times, and the governor had mentioned this, that even though we've got folks kind of assigned to a component group, we don't want people to feel like you're kind of stovepiped into that group only. I mean, his encouragement was to certainly, you know, attend the other meetings if you'd like. You can watch them remotely, of course, or on ETV. So again, don't feel limited in only looking at the issues that are kind of before you. So I'll turn it over to Director Sora.
Thank you.
Or former Director Sora. Sorry.
Retired, yeah. Well, thank you very much, and thanks to the governor for bringing our group together. We have a great combination of folks on the protection team. I think our team probably has the most graduate degrees per capita of any of the teams that are part of AccelerateSC, which means we have a lot of great experience to draw from. The downside is it means occasionally we argue for 20 minutes about a single word choice. With that, I mean, we have a bit of an interim report here available to talk through, and I think, you know, to kick things off, we have sort of 4 priorities that we highlighted as being areas in which we tried to focus our work over the course of the past week or two. These are the priorities that appear in the materials that created AccelerateSC. And sort of headlining them at the top there is this sort of dual mandate that the governor talked about in our first meeting, in which he talked about the importance of protecting what he described as the economic vigor of the state, while ensuring that we have the appropriate policies in place that can protect our public health as well. Within those priorities, we have 4 different activities that have been sort of our focus areas that we've tried to organize our thinking and organize our recommendations, or sort of initial recommendations, into. And those 4 activities are preventing, testing, responding, and adapting. Usually in government, you try to come up with some kind of a clever acronym for these things, but we're on a very tight timeline with our work, and so PITRA doesn't really say a whole lot. We'll keep working on it. Moving into that first category of preventing, you know, we started with the basics, and of course the basics are the same public health advice and recommendations that you've been hearing from CDC and from DHEC over the course of the past couple of months. And so those guidance, you know, bullet points about, you know, washing your hands and covering your coughs, whether into an elbow or a tissue that you then throw away, making sure that you practice social distancing still, making sure that those who are in sort of, you know, classes that are the most at risk continue to do everything they can to either stay home or stay safe. Those continue to be priorities as we go forward. In terms of our strategy, you know, one of our headlines has been that, you know, acceleration has to be thoughtful and deliberate. And I think those are terms that you've heard quite a bit in our meetings so far and are likely to continue to hear in the coming weeks. But But this is going to require a phased approach, and a phased approach that is going to reflect our evolving and emerging capabilities. One of the things that we struggled with in putting together our interim report is that literally every day our ability to test and respond is changing. And so just as we're growing in terms of our capabilities, our ability to respond is also distributed all across the state. Testing is conducted in multiple locations across the state. And so, we wanted to give some thoughts about things as they are today, but also lay out some thoughts about the long term, as the governor asked us to do in pulling together this group. And so what we'll talk through over the course of the next few minutes is about, how do we make sure that we keep the infection rate low enough, this, curve flattening that we've talked about so much in recent days. How do we make sure that we shape that curve in a way that lets us preserve capacity in our health system to make sure that we can continue to meet the needs of South Carolinians, not just who have COVID, but who have any other condition, that there's not any kind of crowding out effect. And so we tried to be thoughtful about that. And we also know that our response is going to have to continue to be tailored to meet the needs of local communities and to meet the needs of special or certain populations that are being more acutely affected by this as we go on. So if those are the basics, I think in our sort of initial thoughts on preventing this first activity, it's things that we've been hearing and things that we've been telling people for weeks and weeks and weeks. Please continue to follow the advice of public health authorities. For folks who are in at-risk populations, seniors and those with serious underlying medical conditions, I think those are the ones who need to be the most mindful of this guidance and have to be the most certain that they continue to adhere to it. There are high-risk settings, such as nursing homes especially, hospitals and others, that are going to have to continue to enforce pretty stringent visitation policies. All of us have, probably interacted with this in some way. My grandmother's in a nursing home, and I have not been able to visit her for the past couple months. I would like to go visit her, but I also know what the risks are, and I accept that, that we're doing the right thing at this point. And so there are places where some of these policies are going to have to stay pretty restrictive for quite some time. In our fourth recommendation, which is in about 8 million different parts, we start to look at what are the kinds of things that employers should be thinking about as they sort of hit the gas pedal a little bit. And there are a number. And I should say that this is a few bullet points for now, but one of the areas in which we continue to work, and one that we know that employers are going to have to react differently depending on the environment in which their staff are at any given point in time. So that environment has to remain safe for customers, obviously, and staff, right? That you need to think about how to protect both of those different audiences. And the best practice guidelines are going to continue to evolve, just as everything else has throughout this. In terms of that kind of guidance, OSHA has come out with a sort of a manual, basically a resource for employers to look at as they think about how to react to all of this. And they've talked about basically a sort of a risk-based stratification kind of model, that you look at your staff, you look at the sort of physical environment in which they work, and you look at what kind of contact they have with members of the general public or different audiences, and start to think about what kinds of procedures do I need to put in place, and how should that vary based on those different types of employees. As part of a broader strategy, employers should also think about measuring temperature. And we've all seen a number of different stories about how that can work. In some cases, it's something as serious as the sort of walk-through scanner-style equipment. We've seen examples of the laser temperature readers as well. There's also different, almost wearables out there that can give you a sense of what it might look like. That is something that we did have a bit of a footnote in, which is that we wanted to remind everybody that that is not a solution by itself. It can be part of a broader strategy. But there are a number of cases in which individuals are able to spread this disease before they have any kind of visible symptoms. A few of the bullet points in this front, we ask employers to continue to support telework and flexible work schedules to the extent possible. I know even where I work, we've talked about doing an A-team, B-team model where half the group comes in on a couple days and the other half comes in on others, to try to keep as much space between us as possible and try to reduce the risks that are associated with direct contact. DHEC's done a great job of putting together communications materials. They will continue to do that. And I'm saying that not just because I'm in striking distance of Director Toomey, but because they have. It's going to be important for employers to have materials. Employers are going to have enough to worry about in trying to think about how to bring people back to work and about the financial implications of everything we've seen over the course of the past couple months. And everything that DHEC can do to put together those materials to help support that and take one thing off the list is going to be helpful. Sanitizer and disinfectants, obviously, should be readily available and accompanied by highly visible signage that explains how to use those things. We also ask that employees not return to work, and again, this is the basic public health guidance here, until after they've met the criteria. 7 days have passed and symptoms have begun, and they're free of fever for at least 3 days, and their symptoms has improved. And in the healthcare community, there's additional guidance that goes above and beyond that. And then finally, there's a bullet there about how, if someone is showing symptoms, make sure you send them home. And then also make sure that that's not the only thing you do. You have to make sure that these people get connected to the healthcare community as well. So on the testing front, and I think we're moving into some of the new material here. So this curve just gives a sense of what we've already seen as we've monitored the broadcasts over the course of the past couple of months. The number of tests that we're performing continues to increase over time. There are lots of different testing machines out there. And sometimes, they use different reagents or they use different testing kits that are not necessarily interchangeable from one testing platform to the next. So there are limiting factors out there sometimes. One point that we wanted to make sure that we explained is that there are, different places where you can get tests. And the sort of proportions of that will continue to change over time as well. So you think back a month or two ago, and the only way to really get a test was going through DHEC's public lab. And the availability of testing, as it continues to increase, we're not just increasing the number of tests that are available, we're also increasing the number of places where you can get a test. And so there's been this sort of democratization of testing as it sort of gets out into other settings. And that's good, but it means that you can get tests through hospital-based laboratories. Tests can be run through some of the contracted out labs as well. And so we had a number of questions I think we've already faced about, when will testing arrive in my community? And what this slide is meant to illustrate is that we're getting out into more and more settings over time, and we'll get to more detail on that in a second. CDC's testing guidelines have continued to expand to include more and more different kinds of populations, and these tests can be used for different reasons. So at the top of their list for high priority are obviously folks in hospitals, those who are expressing symptoms who are in direct contact kinds of positions, healthcare workers, first responders, and so forth, and then residents in some of these sort of high population, high density settings such as nursing homes. There will not be a quiz on this slide. You probably can't read it wherever you're sitting anyway, but it was meant to sort of show where CDC is going, right? So just as I mentioned a few minutes ago, that our group has been trying to focus on what's available now and what will be available soon. This guidance, I think, is a bit of a nod to the future, that we are now at the stage where we are beginning to move more and more out into the community to be able to do testing in hot spots and in communities where we need a better understanding of what the spread looks like, and as long as that testing is being conducted as part of a broader public health strategy that fits within the CDC's guidelines. This slide is meant to illustrate sort of a second point. When we talk about testing, we tend to just talk about testing and not necessarily differentiate between the two kind of high-level kinds of testing that are available. And so on the left side of your screen, there's something there about PCR or sort of diagnostic testing, right? So these are the tests that involve the swabs. They help you understand whether or not you have sort of an active case of the disease right now. They're the most widely available, at least at this point. But again, these require specialized equipment. The right side of the column talks more about antibody testing, which is where things are sort of moving, but tells you a sort of a different thing, right? So the antibody tests basically let you know whether this person has been exposed to this virus at some point in the past. So one test helps you understand who is sick right now. The other test helps you understand where has the virus been in the past. And so each of those tests have a different role, either in, on the one side, thinking about how do we treat people today, right this second, individually, In a lot of ways, the antibody tests help us understand what we need to be doing from a community-wide perspective. In terms of recommendations for testing, there are free resources out there, and I think we've talked about this quite a bit. The purpose of this slide was just to let folks know, there are screening tools that are out there. If you're worried about, if you're worried about the finances, if you're worried about, will this cost me money, there's a lot out there that you can look at online, look at on your phone, and at least get free guidance and potentially referrals if necessary. One of the immediate priorities that's been clear, and DHEC has emphasized this in more of their public briefings of late, has been that in settings such as nursing homes, there is a significant risk. We saw the stories out of Washington, for instance. And so, more and more, I think DHEC is going to try to bring some of this new testing capacity that's coming on board to make sure that we're looking at both workers and the residents in these settings to make sure that we're keeping everyone safe. The emerging testing capacity needs to be part of a broader picture. So we have tried to avoid using jargon and industry-specific acronyms wherever possible. I think we've maybe failed on this slide right here. But the point here was that as DHEC assembles this statewide testing plan, we want to make sure that the hospitals and the federally qualified health centers and the Office of Rural Health and the area agencies on aging and all the other community partners are part of that regime, that everyone fits inside of it, everybody understands their role, and that we are making the highest and best use of all the assets that are at our disposal as a state. Test results. One of the things that we've struggled with, and this is hardly speaks to everyone, but there are some test providers out there who have bundled their results together and only produced reports on a weekly basis, in some cases even on a monthly basis, or they only report positive cases and not negatives. And so we'll wind up coming towards a few recommendations, I think, before all is said and done, about how to make sure that we automate that process to the greatest extent possible, that we get the full range of those test results reported, and that those things are reported into a central repository that is available so that healthcare providers know what results have come up for patients they're treating, and to make sure that people here in state government can make the best decisions for everyone. We're going to have to continue to refine our strategies as more testing comes onto the market. So it is certainly helpful to have more tests available. We have talked about the need to risk stratify employees as time goes by. The FDA has sort of announced some new actions since last night, basically, where they are going to update a policy they put in place the last few weeks, where they've been allowing tons of new tests to come onto the market without necessarily going through the historical validation process. They've changed course last night and said that they're going to give those new test suppliers 10 days to turn in the appropriate material that'll be necessary for FDA to be able to thoroughly validate those tests and make sure that they're all as effective as they need to be. Responding. One of the things that we've talked about, a couple times, is the need to ensure that as testing capacity grows, that we're now, transitioning into a period where there's going to be enough testing capacity available to break beyond the walls of the public health lab, to escape the hospital laboratories as well and get out into the community so that we can get a better understanding of where this virus has been and where it's going. We know that there has been a disproportionate impact on some groups so far. So, this slide is meant to capture the breakdown of the population statewide, and then how that changes when you look at where the cases have been and then where the deaths have been. And it tells us that we need to make sure that our testing capabilities and our response capabilities can get out to the places where we're having the greatest difficulty. This is one of the zip code maps that comes out of DHEC, and it helps us think about where we need to focus our efforts. The illegible screen cap that sits next to it is from a report that DHEC has started to release on nursing homes twice a week. So all this information has to get tied together in a way that we can use it to target our capabilities appropriately. DHEC's going to have a series of rapid response teams that can bring enhanced testing and contact tracing to hotspots. We talked quite a bit about contact tracing in our group meeting a few days ago. And this needs to be aligned with public education campaigns that are culturally appropriate. We have to make sure that folks have the right language capabilities to interact with people in the public in order to do this work. And we have to bring all the local resources that are available to bear and make them part of an integrated strategy statewide to address these things. There is a new online certificate program from the association that Director Toomey and the other comparable state public health leaders belong to, and they've put together a certificate program so that we can enlist the army of contact tracers that we're going to need. One of the things that I particularly like, if we can back up just real quick on the 11, one of the things that I think is good news that DHEC has been able to commit to is a dramatic increase in the number of contact tracers who are available in South Carolina to track down this disease and to be able to follow it and to contain its spread. We talked a few days ago about how there were 130 contact tracers in South Carolina. That number's already increased notably since we had that conversation, and DHEC is now committed to have 1,000 contact tracers identified by June 1st to help us limit the spread of COVID-19. And that's going to be a very important step to help us understand where this disease is going and to help us to get resources deployed in a way to limit the further spread. 12, DHEC should engage with other folks out there who I think can bring important capabilities to bear in terms of data and expertise. For instance, there's been a care line. It's taken thousands of calls from DHEC. Maybe we can use those call records to help us figure out, are the calls coming from certain communities, from certain areas? Is that a leading indicator that we need to start bringing resources into those settings? In the next area, adapting, there's a few takeaways that I think we've already, kind of come away with, even at this point, before we get to sort of a formal after-action report. One is, we know that we need more than the Strategic National Stockpile. That stockpile is an important part of our preparedness and response. It is not an exhaustive approach to preparedness and response. We know that we can do more to bring other data sources online and integrate that as part of our response strategy. And we know that these contact tracers who we are now out in the process of enlisting are people who we're going to need again at some point. All of us who've been through H1N1 and Ebola and been through the last several of these, pandemics or threatened pandemics, I think know that it's only going to be a few more years until something like this shows up again. And so the resources and capabilities that we're developing today, we want to make sure that they stay ready for us to use next time. One of the things that we've asked for is, and I know will be a formal recommendation as we get there, will be when we think about next time, we need a different way of getting our hands on that personal protective equipment, the PPE, the gloves, the masks, the gowns, the plastic face shields, and so forth. And so we know we're going to have some kind of recommendation around that. I think one of the things we'll ask for is to have a formal study, is to bring somebody in and help policymakers weigh different approaches to either a broader collaborative or even a sort of a state-based stockpile. And then 14 points. I think I read somewhere that 14 is the right number of points to have. This contact tracing that we network that we put together needs to be available as a ready reserve for the future, and we just talked about that a moment ago. So that, I think, is a rundown on where we see things at this point. There are a number of topics that we're still working through and talking through, and so I'm glad to hear we'll have a little bit more time to continue that effort. We talked quite a bit about smartphone apps. There's a number that are in development. We want to make sure we have the right, I think, kind of thoughtful recommendations to go with that. We want to make sure that we think some more about what the data resources are that are out there, that we vet them, and then we work with DHEC to see how that fits in with their broader view of how technology can be brought to bear to help us solve these problems. And then finally, I feel badly for Chuck Spangler, who almost joined us during our protection group meeting a few days ago, but was limited to because he had a patch apparently that applied to his laptop and forced him to restart in the background immediately at the very second that he was starting his slide deck, and it took him too long to be able to figure out how to restart it and get things running again. So he did not join us, but he was going to talk to us about the Emergency Supply Collaborative you just heard about a few moments ago, and that collaborative is something that we've put together on the fly, not just to help healthcare providers have access to protective equipment, but I think is also going to be something that we can use to make sure that the business community, as we get back and re-accelerate again, is going to have access to the resources they need as well. So that's a rundown of the Protection Committee. Questions?
Does anybody have any questions? John?
Yes, I have a question. Over on the Response Task Force, one of our critical areas is childcare. As the governor mentioned, with 1,255 facilities in the state shut down, it's a problem allowing people to come back to work.
Right.
As far as your guidelines are concerned, we know what the high exposure population is, but would you have the ability to specifically target guidance for childcare facilities? Because I'm at a loss to find out how much of a spread threat childcare facilities are.
No, I mean, we're certainly glad to put that on our kind of punch list. I mean, we talked about it indirectly in the sense that healthcare providers are in the same boat as everybody else, right? That, you know, if we need nurses to come to work and we need others to come to work to treat people, they can only do it when they have somewhere to put their kids too. And we spent a lot of time working with the Department of Social Services to figure out, you know, of the half or so of the child care facilities that remain open, is that enough for the healthcare community to be able to stay, you know, sort of resilient and available to treat people who need help with COVID or any other condition. So, I mean, we're glad to take that back to our group and think through it a little more about what kinds of recommendations we might have in the child care front in particular.
Thank you.
Senator Malloy.
First, Chris and Dr. Toomey, thank you so much, and thanks to the governor and Dr. Toomey. I did not see DHEC name up there for the testing, but I will say after the governor got involved on Friday, DHEC partnered with Care South, and they had their pilot program for the state over in Society Hill with a population of about 530 people. After starting at 10 o'clock today, as of 1:30 to between 1:30 and 2 o'clock, they had already done 347 tests. And I want to thank the governor and Dr. Toomey for getting the National Guard involved, because they were there setting up the tents. And I think that that's one of their pilot programs going to these areas in the rural communities. And obviously, during this time, we have to continue to mention that the disparate attention that this virus has given to African Americans, because about 53% of those that are dead are African American, and we're about 27% of the population. So continue to end up having your focus on that. And one thing I also ask that you all would put some attention to is that I didn't see it mentioning, but our prison population in South Carolina is about 18,000, of which is a revolving door. It is a group that you have that are in confines, but something that we don't pay attention to, that there's about 500 individuals that's released every day. And so they are coming back into our communities and into the workplace. And I'm not certain what the answer is, but I would hope that you all could start thinking about partnering with Brian Sterling to see that those that are tested, that can be tested, so when they get back in the community, at least they will end up knowing, so they can end up practicing social distancing. Because what happens is that they are the tier in the workforce that are the laborers that will bring them in contact with the public. And so I didn't see anything as it relates to our prison population.
No, that's right. I think both of us, do you want to?
My nickname in grad school was PA. I can talk loud enough, I think everybody can hear. I probably talk to Brian Sterling 3 times a week. Absolutely, corrections area, the individuals there are somebody that we are concerned about and are working with the department on to make sure as they come back in, but not even as they stay in, things are managed in an appropriate manner. Thank you.
So I hope the internet picked that up. All of us in the room definitely heard it, though. No, and as you say, I think we've from the hospital side been talking to Director Sterling since January about how to make sure that we can manage the case. The slide about the CDC guidance did explicitly reference the correctional population as being one of the high priority areas that we'll need to continue to work with. And then just as you say about the importance of bringing our testing and response capabilities to the communities that are being the most affected. That was what the sort of color bar chart was meant to highlight. So I'm glad you brought all those points to the forefront.
And sure, which would include the mobile unit testing, because those individuals that are around now, they have these big units that are there in some of the pockets you're not able to get into. So the groups that don't have the mobile testing, obviously I think that would be a critical aspect of it.
That's right. Well, and I think just in the next day or two, I think DHEC is going to have more to announce on that front as well.
Great.
Representative Pope.
Since this began, I've had a number of constituents contact either wanting to help. I know we had the big fly-in with Boeing on the personal protection equipment. I've had a number of businessmen that maybe have relations overseas or even locally from a textile standpoint. Is there one place, because I heard you again say PPEs are an issue.
Sure.
Is there a kind of one place we should send? I've kind of, with my constituents, I always say, reduce it to an email and get it to me rather than tell me at Walmart, and then I can figure it out. So where should we be sending that? And that's probably more global than just you guys, but where should, if there's opportunities there, where should we be sending these businesses? And
Right. I mean, so I give, any business that can help, particularly on the protective equipment front, can either contact EMD or they can go to sccovid19.org, and that's the website for the South Carolina Emergency Supply Collaborative. And those are the folks who are bringing together, businesses and manufacturers and suppliers who have access to that protective equipment and matching them up with people in the business or healthcare community who have needs for those particular resources.
And again, that's sccovid19.
Yes, sccovid19.org.
Thank you. Thanks.
Lou?
Yeah, what I'd like to say, and I announced this in our response group the other day, Nephron has purchased, and I'm saying this as an employer trying to help out because I understand the tight timelines. DHEC is working with the amount of equipment they have and so forth. We have purchased antibody testing equipment as well as PCR testing. We are using the DHEC zip code map. We started our first round of 80 employees this past Friday. The equipment and test kits that are all validated and will be validated on site. We're working with Dr. Cole's team at MUSC for positive controls and so forth. We're happy to extend that past the Nephron employees. I announced that I'd like to start with my street, which represents about 10,000 employees, including Dominion, Amazon, CMC Steel. But we don't want to stop there. We are using the zip code map to decide who to test first in our own company, and then we would like to open that up and help DHEC and anybody else who needs testing. And also, there are quite a few other companies that have validated testing not on your list up there, including Vicor Scientific and Precision Genetics, to name a couple. And I think if you look on that COVID-19 site portal that you just mentioned, you'll be able to find some extra ideas there as well. And then we have been reached out to, as you mentioned, by other businesses wanting to offer us PPE. We've been able to secure what we need. So the first offer I received from Okra Medical, I sent them directly over to Molly Spearman, and for the lunch workers and teachers, I said, we don't need your donation, but they very much do. So there are people out there really looking, and if they don't know about that portal, I think that's a really good starting point.
Sure. Thanks for that.
I just want to let you know that the South Carolina Manufacturers Alliance, we're also working on the PPE kind of coordination and collaboration as well. So we're happy to help Representative Pope if you got anybody in your community with the coordination of the PPE as well.
Great, thanks. All right, well, thank you.
Any other questions?
Mr. Chair, I have a question. We use a rolling number to report the number of cases. As we prepare to get back to work, is there any value in us reporting the existing cases? Because in a lot of cases, these cases go back several weeks. Folks have been sick, cured now, or back to work, or back to their daily activities. I'm just wondering, from a reporting point of view, is it value in I'm talking about existing cases?
I know what I think. I'm going to defer to Director Toomey, though.
So I won't touch the microphone or the podium. I've learned. All of my friends, if I do it, they get in touch. One of the things that we unveiled yesterday and showed the governor was exactly that, a 28-day and a 14-day rolling average of the positives versus the negatives tests to show what's happening over time. And I think that's very important. The other aspect that we present some of the data on the for first responders, the coroners and stuff, is a 14-day rolling number of who's out in the community. So yes, we show something cumulative, but that is just purely cumulative going back to, I think the first case was March 5th. So I think as we segment and transition to accelerating and putting, as Christian said, putting a little bit of gas on the accelerator, it's important for people to understand that a majority of the people, the event has passed them by. And so yes, we're starting to dice that information a little bit more in segments. Dr. Cole.
Just add to that, Dave Cole. I think it's a really important question, and one of the things that we've been emphasizing, I think, is two things. As we move forward, you need to pay attention to the capacity of your regional and local health systems in terms of patients. And then ahead of that, it's not the number of patients, it's the incidence of new cases and the prevalence of the disease in your community. So as long as you can, so we need to pay attention to the new cases, and I would say also not just at a statewide level, that's too blunt. Infections are local, it's your communities and the actions you're doing locally that make a difference. So when you start seeing in your region, and we should have the data available and will, then you can start understanding if the incidence is going up, then there needs to be some actions that occur to keep that, sort of put that genie back in the bottle as you're moving forward, so that you can, keep things appropriate, they can keep them safe and react. The reaction is going to have to be at the local, regional level, not at the state or national level. So it's not the historical data, it's not the sort of the report out of X number of cases, it's the incidence of new cases and how many people in your community actually have had it before. It's those two in combination that really create the green light, red light sort of map, if you will, if that's helpful.
And that's where the importance, I think, of the zip code, the numbers by zip code daily is an important little trigger point to watch. Dr. Cole is absolutely correct, because what's happened in the past is it's in the past, and it's not the indication or whatever the investment advisors always say is not a prediction for the future. Got to monitor the future every day.
May I ask?
Superintendent Spearman.
Thank you. And I live in a zip code, a rural zip code, as I expressed, that is I'm very concerned about my community in Saluda. No hospital, limited health care availability, and high Hispanic community who are afraid to be tested, and others, very rural area. So whose responsibility is that then to take action for those local zip codes? I mean, the governor's been doing statewide. Is that DHEC coming in when there's not a lot of leadership there in that community? I mean, we don't have a resident senator or anyone to ensure, but who's responsible and what action needs to be taken in those local communities when you know there's a hotbed?
As we've talked, it is DHEC's responsibility in developing our testing plan and looking at where are the resources, where are resources not available, where are the hot spots, where can actions be taken to help intervene not only with testing but education, communication, and matching up the individuals that can help us transition for those that may be afraid to talk to someone, but there's usually somebody in the community that can bridge to help facilitate, to make sure that, yes, we are from the government and we're to help you, and you don't need to be afraid of us. And so it's very important. And you may be that one individual in one community, and the local pastor, the local teacher, principal, football coach can be those individuals that each community can help identify as we look to partner. And Christian said it. It's not just DHEC has a lot of capabilities, resources, but this is a big state. There's a lot of institutions, a lot of healthcare providers that we work with every day. The Hospital Association, we are actively engaging every federally qualified health center, FQHC, to find out what are their resources. Do they have enough testing kits? How can we assist them? Because they are in many of those rural communities where other providers are not. And so it has to be a team event, but DHEC has to take some of the accountability and responsibility to coordinate that.
Thank you. Again, and I'm sure we're not the only rural county in that same situation, but those of us without a hospital in our county or without those medical leaders, it is a challenge, and DHEC can't do it alone. There has to be some group that's contacted. So, as I've told you, I volunteer, but I know that there are other areas in the state probably in the same situation who don't have that structure in place for you to rely on to bring together the community. So I'll help, but I know that our county is not the only one, so I appreciate any kind of attention to that. Thank you.
Governor.
If I might add.
Literally this morning, Director Toomey and I talked about the role. Literally this morning, Director Toomey and I had an email exchange about the role that the Hispanic Alliance of South Carolina can play in the very question you just described.
Thank you.
Oh, Dr. Toomey, if you could go into a little bit about the environment out there where we have a lot of different entities. MUSC is testing, Prisma is testing, and I'm referring to the swabbing, and then that has to be sent to a laboratory somewhere. And we have the mobile unit, the mobile operation that Senator Malloy was referring to. And Dr. Toomey's got some pictures of that. It's 3 Army tents that the National Guard set up, and the people drive through in the vehicles and go in one end and come out the other end. And that's the way it works. And it's started with, I think, 103 people the first day, and now, as the Senator said, already an hour or so will go up to 300 and something. But when will we be able to see where all these assets are located so that our people will know where to go on which day to get tested?
There's been a lot of efforts and a lot of partnerships and a lot of initiatives by many organizations, MUSC for one, Prisma, and as soon as I name a couple, I'm leaving others out. And one of the things that I've asked my staff to do is to pull together not only where have they been, but to the best of our knowledge in working with the partners, even if we're not involved in that one site, to have a central location that we can put on the website, we can communicate to the press. I know MUSC does a great job when they're going to be in a certain area. They communicate that to the representatives, to the local leaders. When we're going to be in an area, we communicate it. But to make sure, and exactly what the governor is saying is, we need to make sure the individuals, the citizens, the community knows where those test sites, those mobile sites can be. DHEC is in conversation with Walmart right now, and they've offered to set up sites in the Walmart parking lot where they can bring in like a pod, a box that is self-contained with everything that they need to do at that site, and we're coordinating with them what are those locations. I think they said they have 105 locations in South Carolina. I don't think they offered to do it 105 times, but they said, let us know where the priority is and we'll go there with you. So there are national companies, there are the local institutions, statewide institutions that are working to try to make sure we bring access now that we've transitioned from the issue of testing where the supplies were so limited that you prioritized it. Now that the supplies, the reagents, the testing capabilities by not just the DHEC lab, but the hospitals, private labs, individual labs. I think we have over 100 labs that can report their data, their findings to us. So there are a lot of individuals out there that have the capabilities, and we just need to make sure people understand where and when they can get the test.
One quick, it's really more of a question, but a suggestion too, I guess. I don't know what the construction or the organizational structure of your contact tracers is, but if we're going to have 1,000 of those, then it seems that that's a good group to make sure we have some in each county potentially so that they can serve in the capacity that Molly's talking about, because that's what they're good at, is communicating with people and talking to them and finding out, you know, what's going on. So maybe that's the structure you can use dually. Maybe you may already be doing it.
Excellent point, and yes, that's exactly. I've talked with Molly. We've gotten the faith-based community, this Commission on Aging. All of those have individuals dispersed across the state that are both known and connected that can help us. And so we plan to be like a spider's web, going out everywhere.
If I may, and I really appreciate, I know you all have the commitment to the underserved communities, and you've already identified, so I know it's coming, and you're already on it, so thank you very much. But again, I think the communication out to the community is going to be a real challenge, and those tracers could help. That's great.
Let me get Dr. Cole's had his hand up, so I want to.
Just, I think, if I could, the microphone's working. I think it's, Molly, your question is really important, and Director Toomey is exactly right in terms of DHEC, but I think a thing that we all need to understand, in my personal opinion, is that we have to have, as communities and regions, we need to take ownership and be empowered, which means the missing people are the mayors, the community leaders, the business leaders. That you need to form the groups to actually monitor the data and be able and willing to act. You have the ground level ability to make a difference when something ain't going right. You know, so to me, the missing people, missing items, and the reason I said that this isn't just a blunt statewide thing, it's within your region, it's within your community. You know, so the leaders in the community are the ones that need to step forward and interface with DHEC and interface with state leadership, as opposed to hoping and assuming that DHEC's going to have the insight to know what's going on in your community when things are not going correctly, and I hope that they all will perfectly. To me, I think it's important to understand we have to take responsibility as individuals, as communities, as business leaders now.
One other thing.
Yes, sir.
It was mentioned earlier that Senators Graham and Scott were here the other day speaking of this. Also, our congressional delegation has been deeply involved. And in the latest conversation with Congressman Clyburn, his last words, tell me what I need to do. Tell me what you need. So we're sending him a list. So it's, everyone in that arena is fully engaged.
Can I, I'm going to ask a couple of questions, and either one of y'all can answer. It's fine by me. With respect to the collaboration on a state testing plan and a strategy, how is that taking place? Can you kind of address collaboratively how that works? I mean, is it you know, are we communicating, collaborating, all the 3 C's that the governor talks to us about? Can y'all walk us through that?
Yeah, we focus on the 3 C's constantly because we recognize it is a partnership to accomplish things. We've been working on our testing plan, our collaboration plan, the strategy to go out to rural communities, to working with different entities. And part of that is, I don't want to prematurely, but I think in the next day or 36 hours, we plan to roll the plan out and talk about it. And I'm not the best person to talk about it. The individuals that helped craft it, the individuals that are going to be responsible for implementing it, the individuals that are going to be responsible for making it work, although while I'm the director, we are working very much so, and it is a collaboration. It has to be a collaboration, as Dr. Cole said. You know, the old saying, politics is local, but so is healthcare. So is healthcare. Healthcare at the root is at the local community. And if you look at what we have asked, looking at manpower, physician, nurses, nurse practitioners, PAs in the population by each county, you can see where they are underserved and undermanned, supplied by not only not having a hospital, but the number of medical professionals in that area. So you look at a lot of different data points, and it does identify both points of need, but you also look at the data, as Dr. Cole said, and where the hot points are, and those are what sets the priority for us to identify. We're going to be in these 5 communities in the next 3 days, and then after that we're going to be here. But 5 is a small number. We need to maximize it. And again, partnerships that we have with the medical community, with the laboratories out there, it's a responsibility not just DHEC, but DHEC has to work with multiple providers, James, to get it to be accomplished, and to make the state as safe to continue moving forward as possible.
Well, and I think that's one of the things that I think when we're looking at how we kind of accelerate forward, and knowing that, hey, look, the call for the recommendation for 1,000 contact tracers, a testing plan that addresses various issues and constituencies, so that you know, as people move forward, there can be some confidence. I mean, we know this thing is going to be here, but there is some confidence that it can be addressed safely, smartly, in a way that people can leave the crisis of confidence and move forward as they go back to work and as they continue on with their lives. So I think quickly, Senator Malloy had needed a couple of seconds for one point.
Right, and so the question went out to the Department of Corrections of how many prisoners were released each day. The response was 400 to 500. They just sent me a note back that said it was about 600 per month, but that does not include those that are released from the local county jails on a daily basis. So it's not as bad as we thought. About 600 per month. And Governor, the numbers in Society Hill that you set up for today, they've just completed all the sales, and they got all the tests up to 465. All the tests.
Thank you, Senator. I think that's everything. Thank you, Christian, and thank you, Director Toomey. What we'll do is I have 10 minutes in there. We're going to make it 5 minutes. I'm going to ask over this period that y'all properly social distance. If you're going to be close to somebody, put your mask on. I'm looking over there at Dr. Duvey to let her know that we will mask ourselves if we get close. But 5 minutes, and then we'll get completed. Thank you.